There are low vaccination rates for kids under 5 in California, and with new variant concerns, doctors, they're encouraging parents to consider the shot before heading back to school. Dr. David Bronstein is a pediatric infectious disease specialist with Kaiser Permanente, and he joins us this morning. Doctor, good morning. Thanks for waking up with us.
Good morning.
So the biggest thing is, let's talk about the low vaccination rates in kids under 5. What do the latest numbers show us?
So the numbers are looking like it is a slow start for that younger age group, much like we saw with the older kids, the 5 to 11s. We're seeing that still, there's about 19 million kids in the country who need the vaccine 4 years and under. And we're definitely less than a million so far, probably around 400, 500,000. So sluggish start, but that's expected. It takes time for people to be comfortable, and I encourage everybody to talk to your pediatrician. And in fact, for this vaccine in particular, so much of it is given in your child's pediatrician's office. So it's a little bit harder to get. You can't just go to every store on the corner to get the vaccine.
Yeah, talk a little bit about why it's important that parents get kids 6 months to 5 years old vaccinated against COVID-19.
I know a lot of people have that idea that COVID is more mild in kids, and that's true for the most part, but not for every kid. Unfortunately, over time, we've seen hundreds of kids in that age group who have actually passed away from COVID since the beginning of the pandemic. That actually is the highest risk age group for kids, is the really young ones, especially those infants out there. And so anything we can do to protect them is tremendously important. And really the only way to do that is the vaccine. A lot of people right now are thinking, well, my kids already had COVID, or my kids had even Omicron. But keep in mind, that was most likely during that winter surge, and that's many months ago, at least 6 months ago or so. And so we have a whole new population of kids as well as adults that are once again vulnerable because your pre-existing immunity has worn off already. So lots of vulnerable kids out there. And while most kids do fine with COVID, there's a decent percentage of kids, even kids without underlying health disorders, who can still have very severe complications, wind up in the hospital or worse.
Yeah, Doctor, a lot of people probably feel like this is a broken record and they're just tired of hearing about COVID over and over again. But yet we still can hear about new COVID-19 variants that are actually pretty infectious for a lot of people. Tell us what families need to know about the newest COVID-19 variants.
So first of all, it does feel like a broken record, but unfortunately, there's no end to this record in sight. It just keeps going and going. And every time we wind up with usually a new subvariant that's more transmissible than the last one. Right now, the one that's in the news, because it's taken over as the dominant strain, is the BA.5. It's a subvariant of Omicron. So everything we've been seeing for many, many months now is still Omicron. And instead of getting new variants or new Greek letters, it's just different versions of the same Omicron that become more and more transmissible, so that, first of all, your previous immunity doesn't protect you as much, and it's easier to spread from person to person. Fortunately, the subvariants that we've been seeing don't seem to be more severe, but if you have a larger number of people who are being infected, then you have more people who do wind up in the hospitals and bad things happen. So not more severe, but still can be very, very serious. And I wish I could predict what the next subvariant will be, or if there will be a next variant. But what we've seen now for the past, years, I guess, is that there will be something next, and there sure doesn't seem to be any sort of break in between.
All right. Well, Dr. David Bronstein with Kaiser Permanente. Doctor, thank you so much for your time this morning.
Thank you.